So now the question is, how do you deal with it, right? Obviously, you need to assess, like, what is their current training volume? Are they doing things outside the clinic that they're not really telling you? If you trust your program that you're doing and they're still having this knee pain and it doesn't really make any sense, maybe diving into, hey, what are you doing outside the clinic? Video, I'm going to be talking about a potential complication that can happen after ACL surgery. I'm talking specifically mostly about patella tendon grafts, but potentially can happen with other grafts as well if there isn't proper loading that happens throughout the entire course of rehab. And that is anterior knee pain. For patella tendon grafts is probably the most common graft. It is the most common graft due to the fact that they are obviously cutting away about a third of your patella tendon to replace the ACL. So it is a little more susceptible to having anterior knee pain or developing tendinopathies. And for the most part, if you manage them well and making sure that they're cognizant of how much they're loading, not doing things too early like running, jumping, sprinting, all that kind of stuff, usually people will have a pretty good recovery without dealing with anterior knee pain. However, sometimes for whatever reason, whether they're loaded too much or honestly potentially bad luck, in certain situations, they can develop anterior knee pain. I honestly, truthfully, am a perfect example of this. I was very cognizant of how much I was loading my knee. At this point, when I record this video, I'm 6 months post-op, and I'm still dealing with anterior knee pain. For the longest time, I thought it was scar tissue. I had multiple people look at it. I even consulted with other ACL specialist because I felt it was good to kind of take a step back in my own rehab, and sometimes you're blinded by your whatever certain biases that you may have, particularly when it pertains to your own body. And I had multiple people tell me that what I was describing is tendinopathy. In this video, I'm going to talk about obviously how to deal with that, which I'm currently honestly still addressing at this point in time, but it has gotten better. So for me, the pain is right along the tendon. It's also mostly pain with any type of quad loading, particularly with a positive shin angle. So when your knee is coming forward. When I do any type of force absorption, so trying to bend that knee and absorb, particularly on my left leg, that will cause anterior knee pain. Squatting, split squats, Bulgarians, things like that, step ups, those are all relatively okay. I feel a little bit of anterior knee pain. But a forward heel touch, obviously heavy quad anterior knee base, that will kind of trigger the symptoms in the front of my knee. And if your patients do end up developing a tendinopathy, those things should pretty much align from exactly what I described in this video of plyos will make it worse, landing will make it worse, any type of, again, heavy quad loading, positive shin angle will cause more anterior knee pain. So now the question is, how do you deal with it, right? Obviously, you need to assess what is their current training volume. Are they doing things outside the clinic that they're not really telling you? If you trust your program that you're doing and they're still having this knee pain and it doesn't really make any sense, maybe diving into, hey, what are you doing outside the clinic? And you'd be surprised about some kids when they're 4, 5, 6 months out, they start to feel really good. They're going on these 2-3 mile runs and then playing basketball because they can start shooting around a little bit, or going outside on the soccer field and kicking the ball a little bit, things like that, where they're doing way more than potentially they're expressing to you. So again, dialogue is super important between you and the patient. And let's say that they have been doing a lot of stuff on their own and then they've kind of flared up that tendon in front of their knee. Now what do we do? So there is a good amount of evidence out there that supports the fact that isometrics is a really good way of trying to kind of calming down the tendon, still building a little bit of strength and just getting that muscle to contract while creating almost an effect in the tendon that helps almost the nervous system recognize hey, we can contract the tendon without necessarily pain. So there's ways to do isometrics at varying ranges. Ideally, at home, the recommended dosage is actually 5 reps of 45 seconds with a 90-second break in between. Ideally, hopefully you can get to it twice a day. Truthfully for myself, I have not gotten into it twice a day as frequently as I might want to, but I will get to it at a minimum of once a day. It is very easy to do. I have posted a video about it before, but maybe just not the correct dosage per se. And it is an exercise I'll give to my patients relatively early post-op as long as it's not triggering a lot of anterior knee pain. So the way that I teach it is basically, I'll show you from the side. It is my left knee. So you're just going to take your right foot and just hook it in front, right? So my left leg is the one that's working for my tendon pain. All you're really doing, at home, typically staying at about 9 degrees is kind of nice, just because there is some people speculating that the ACL is stressed at greater at 40 degrees, but you want to stay at typically about 60 and below. So 60 to 90 is usually a good range. 60 is what they say is the highest peak contraction for your quads. But for simplicity reasons, and especially if you're dealing with younger kids, having them kind of guess to see how far they're going, I just typically recommend 9 degrees, and maybe they'll do 60 with you at the clinic, right? If you're still working on isos and you're trying to calm down that tendon. So here, 9 degrees, right leg is straight down. This is my wall leg. This is the one that's not moving. I'm kind of doing almost an isometric hamstring curl on my right side. And all I'm doing is kicking forward. Nothing exciting here. Kicking forward and holding for 45 seconds. I am very structured with this. I do have my phone with me usually holding, and this usually gets a pretty good burn, okay? And what I recommend is, as far as the anterior knee pain, because it is probably gonna bother them a little bit, I usually say somewhere about a 2 to 3 is okay. Aching, nothing sharp, obviously. And if it scales back quickly, let's say you finish the 45 seconds and you kind of rest for about 15, 20 seconds and most of the pain is gone, that is a pretty good threshold for me. Let's say you try it for the first time, you finish your 5 sets and like, oh, it kind of hurts. And then, you follow up with them later on and they're like, wow, it really hurt until the next day. That obviously means that they pushed it too far. So I think understanding dosage is super, super important, because again, maybe a younger kid thinks that almost like the no pain, no gain type of policy. But that's not the case in the situation, is that a little bit of discomfort is okay, but you shouldn't be shooting up your pain to like a 6, 7, 8 out of 10 pain, and that pain is lingering for days and days. It should be relatively calm after you stop doing the task. So again, a very, very simple way of trying to mitigate patella pain after ACL surgery, again, specifically with patella tendon grafts. So hopefully you guys found this video helpful. Usually I recommend it to be about 6 weeks or so. Some people who are a little bit more chronic might have to do it a little bit longer. And I usually, as far as programming goes, we'll do this at the start of the session. So for me personally, what I would do is I'll usually go on the bike for about 5-6 minutes or so, warm that up, and then I'll hop right into my isos and do that for 5 and 45, and then get on with the rest of my programming for my legs. And truthfully, when I actually do the whole 5 reps of 45 seconds, my quad is fatigued, but my tendon pain is usually a little bit less throughout the rest of the session when I do get into like squats. All the stuff I said typically will irritate it. So it does help it calm down a little bit. I'm currently about 3 weeks in and my pain has decreased. When I try to do like a single leg landing on my left side, it used to be pretty painful, almost like a 6 out of 10 pain. It's probably down to like a 3 or 4 out of 10 pain. So it's frustrating because it takes so long. And it's one of those things that you kind of just have to trust the process for, and they have to buy into the fact that it is going to get better. Someone recommended to me, and I have been trying to do it, is like keeping track of a log on my phone of my pain level, so that you can start seeing it improve. Typically I'll write like how it feels like in the morning, and maybe a quick note as to how it feels at the end, self-rated, like at a 10 scale. And if they want to take extra notes, like, oh, today X, Y, and Z bothered me, and then hopefully in a few weeks, like, oh, today X, Y, and Z only caused a 2 out of 10 pain or a 1 out of 10 pain, so they can see it drop from a 4 to 5 to a 1 or a 2, and then hopefully in a few more weeks down to a 0. Sometimes it's nice psychologically to see some trend, because if we're in it, you may not notice it necessarily. So a couple of points that may help you to manage this tendon pain for your patients. So hopefully you guys find this video helpful. Thank you for watching today's video. Please feel free to like and subscribe and share it on your social media platforms. If you're interested, I have started an ACL Mastermind group, which is a growing library of content centered around ACL rehab. It has exercises ranging from immediate post-op to late-stage sports-specific movements and everything in between. It's a growing library and currently holds over 250 videos. There's content centered around assessments, movement breakdowns, exercise breakdowns, case studies, and a whole lot more. You also gain access to a private forum where you can engage with like-minded people, ask questions, share research articles, and share resources. If you're interested, please feel free to click the link below. Thank you for watching.